What we'll be looking at today is the anatomy basic to understanding the case of a 51-year-old novelist with a weak thumb and tingling fingers. So based on the patient presentation, you probably have some idea what's going on. But we'll first be looking at the anatomy as we would see it during Dr. Higgins' operation. And then we'll look at the prosected side, which has a very detailed description.
Okay.
So this region from the elbow to the wrist is the
Forearm.
exactly. And then the wrist is a region and also a joint.
Okay.
So this is the region. The palm is from the wrist here to the digits, and then these would be the digits. So do you notice anything about the particular patient that we're working with now?
It seems that this particular patient only has 3 fingers.
Exactly. So which one's missing?
The pinky finger,
Which we call?
the digiti minimi.
Digiti minimi, exactly. And this is the digitus indicus. This is the pollex. So at the wrist, since we're interested in the carpal tunnel, and we know that the carpal tunnel is a roof of connective tissue, formed by a roof of connective tissue over the top and the carpal bones in the back, a narrow, unforgiving space packed with tendons and with the median nerve. We'll palpate the bony landmarks just briefly. So we did it on your hand earlier. So here would be the pisiform, here would be the hook of the hamate, here would be the scaphoid tubercle, and here would be the tubercle of the trapezium here. So this is the region where the carpal tunnel will attach, right there. Like that. So it's farther out into the hand than you think it might be. You know that in order to do this surgery and dissection safely, the primary consideration is being careful of which nerve?
The median nerve.
Yes, and 2 specific branches, the palmar cutaneous branch and the recurrent branch of the median. In order to find those, we'll first draw with our purple marker where we think the tendons are. And so I think this is the tendon of flexor carpi-radialis here. This is the palmaris longus tendon here. And so where would the median nerve be in relation to those?
So the median nerve would be between the 2.
Exactly. And so I've drawn them somewhat narrowly, but the median nerve would be there. And then it will go through the carpal tunnel and emerge into the hand. Just before it does that, it gives off a palmar cutaneous branch that runs like that into the hand, and that will come off the nerve and run variably in the fascia on the flexor side of the wrist. And then if we look at the thumb from about here to here, this will be where the median cutaneous, the recurrent motor branch of the median nerve will be. Let's look at the creases. So this is the distal carpal crease. And then what's the line that goes right around the thumb? This is the thenar crease, exactly. Stuff like that. And then this crease is if this is the proximal palmar crease, this is the
Distal palmar crease.
distal palmar crease, which is right like that. So this is your heart line, this is your head line. You're going to be rich and happy. Okay, so those are the thenar lines. Where would the arteries be? So the median nerve and the tendon surrounding it will be the deepest structures going through the canal. Let's look for where the arteries would be. So which is the artery on the radial side?
Radial artery.
Radial artery. So the radial artery will be here, and then it'll send one little branch into the hand, and the rest of it will sneak back like that, and then the ulnar artery is here. And so when we were preparing to come into the growth lab, we did an Allen test on your hand.
Mm-hmm.
And so first we compressed one artery and then we compressed the other, and we saw that your hand became pink again from both sides. So the last line we have to draw is the incision line. And so we're going to angle the incision line in a couple of ways. So we're going to place the incision line so that it doesn't injure, hopefully, the palmar cutaneous branch of the median nerve or the recurrent motor branch here. And the other consideration is what? So in making an incision across the flexor surface of a joint, do we ever want to make a line straight across it?
No,
Because?
because then when it's healing, then you'll create a contracture.
Exactly. And so we're going to begin here, just on the ulnar side of the thenar line, come down like this, and then jog at the wrist around like that. So once again, things we're watching out for. Palmar cutaneous branch will be right under the skin in the fat. Recurrent or motor branch, which will be right about there, we hope. And then deeper, the median nerve, which will be right here. Okay, so we'll get started with the skin incision.